What keeps me going is I enjoy my work. I'm very fortunate to have picked a career that I really like, and I like working with people. Pulling up a chair and sitting next to a patient and looking them in the eye, taking the time to listen, to understand what's going on in their lives and what will they be discharged home to. We have to listen to understand, not just listen to respond. With compassionate care, we improve lives. We can't possibly do that without a lot of compassion. I just see that there's so much good in all people. I just hope for everyone that there is a better tomorrow.
I think all providers should learn how to be active listeners. Being able to talk to the patients and families and find out what's meaning to them and meet them where they're at so they can go on their journey in the best way that is possible. I think that's the only way we get to know them. So one has to just reflect upon that and say, what can I do? And where can I be of value to you? Because I have to make it about the patient, and I have to make it about the family. You have to acknowledge to be considerate, compassionate, and caring. It is what I define and what I always feel is important to be part of my fabric.
There's this intrinsic optimism that kids bring to the table. And no matter how bad it is, there's this seems like tomorrow's going to be a little bit better. And it's a little bit contagious sometimes. Children really want to give you trust. You have to help build that trust. And it can be through body language, it could be through eye contact. And I think sometimes we underestimate the influence that we have as physicians. That trust is a gift. And I can see that I'm getting something back, like a smile or a feeling of ease by that patient. That to me is a gift, and it really is a fuel for me to make me want to do this every day.
I believe that social work chose me. I didn't choose social work. It's just something that's in me. I accept that. And I'm grateful. My love for people is what brought me to this profession, and I feel like it's my purpose. Not only do we have to show compassion for our patients and our family, but we also have to show compassion for one another, for our colleagues and for our staff, and just understanding like what's going on with them, being in tune and wanting to know, hey, what's going on? You know, just genuinely loving people and caring about them and their well-being. Because you have to have compassion to do this job and to work in this field.
I am proud to be an enthusiastic physician at this point of my career. But at the same time, teaching and building new workforce in medicine is very important to me. The role of palliative care clinician is to meet the person where they are and help them to ease that fear they have, or help them to make a leap towards the highest existential maturity they may achieve before they die, if possible. Every person aspires to be seen as kind and compassionate. In our profession, it's particularly very important.
We see a lot of caregivers that have a lot of guilt that they didn't do enough, or they got angry with the person they're taking care of. And those are all such normal feelings. Caregivers sometimes, they just need a break to decompress and be away from that situation. I think that's what's been most beneficial about our support groups. And even some of our concierge consultations is hearing that it's normal to feel that way and that you're not alone. I have a phenomenal team that I am so incredibly proud of. Wanting to help people is so rewarding for all of us personally, but it also really helps us know and realize that we're making a difference in our community.
The COVID pandemic has fairly dramatically increased the work of our HEAR program, which stands for Healer Education, Assessment, and Referral. where we offer no-cost counseling for the entire healthcare family, suffering from either depression, grief and bereavement, interventions for grief and bereavement, and more recently, suicide prevention. But those people working on the front line are confronting overwhelming stresses and strains that we never imagined. And if we are not taking care of ourselves and our family, we're not able to provide the kind of compassionate, skilled care that we otherwise could.